Hi everyone, this is Dr. Stefan. In this video, I'd like to discuss about 13 things that you might want to consider if you are suffering with asthma, because these may actually help you control this condition very, very well. Now, obviously, I'm not your doctor, so this advice is not medical advice for your own specific case, but I do hope that what you will hear in this video will help you have a better discussion with your doctor or your other healthcare providers when you see them to discuss your asthma. That's really my goal. First thing I'd like to talk about is that it's really important to understand what asthma really is. If you know what this condition means, what it is, you'll have the best possible chance of controlling it well, because you'll know what you are doing, you'll know what you're treating, you'll know what each treatment does. So briefly, I'd like to just say that asthma is a chronic inflammatory condition of the small airways in the lungs. Now, this manifests itself with asthma attacks. Now, asthma attacks, you may have heard what they are. If you suffer with asthma, you know what they are. They are basically sudden onset attacks of breathlessness, maybe chest tightness, maybe wheeze, maybe a little bit of coughing, and these can come and go. You may feel absolutely fine in between asthma attacks, or you may have periods when you have a lot of these attacks in rapid succession, and then you may feel well again. Because asthma is a variable condition. It doesn't really go away. That's the meaning of chronic. It tends to stay with us throughout our lives, and many people require some form of mild treatment even when they are feeling well. But that treatment, what it really does is to control the inflammation in the airways. That's what I meant by inflammatory condition of the small airways. So if you control the inflammation in the airways, you stand a better chance of preventing future asthma attacks, and you'll have less and less attacks once you start on an appropriate treatment that controls the inflammation. And the fact that it affects the small airways of the lungs is also really important, because it does suggest that you will need to have a good inhaler technique in order to get the medication to the deeper parts of the lungs where it will actually act and control the inflammation. Understanding that it's an inflammatory condition also helps you understand that your treatments will help control that inflammation. So controller treatment in asthma will help control the inflammation that will prevent asthma attacks. And then also you'll understand that if you're inhaling anything that's irritating the airways, or if you're exposed to any allergens that are triggering your asthma, that will make the inflammation, the irritation in the airways worse. So trying to avoid that obviously helps. The final thing I'd like to mention on this point is that actually inhaler treatment is what most people need for very well controlled asthma. There's nothing else that's required in the majority of cases. And obviously, from case to case, you may need something else. But I feel if you're going to listen to the other bits of advice, you might find things you might be able to improve to help you get the most you can out of the simple treatments that exist for asthma in the forms of various inhalers. The second thing I'd like to mention is that it's really important to understand what well-controlled asthma is, because there are specific criteria established on international guidelines. So well-controlled asthma really means that basically you're not using one of these reliever inhalers, such as a blue inhaler, more than twice a week. So you're only having at most 2 asthma attacks a week, and these only happen during the day. If you're having asthma attacks at night, if your asthma is waking you up from your sleep, it's a suggestion that the inflammation is getting slightly worse, and you might start to get more and more asthma attacks in the next period. So it suggests that the asthma is not really well controlled. So if you're using this only a maximum of twice a week, it suggests that you're fairly well controlled. And your asthma is also well controlled if it's not affecting your day-to-day activities. So this is really important, because the goal of treatment in asthma is not just to help you be relatively well, but still having difficulties breathing. You should be able to do everything that you want to do. So if you want to work, if you want to exercise, if you're not able to do these things, you should talk to your doctor to see whether your treatment can be increased slightly to get a better control of your asthma. The third thing that I would like to mention is that you should have an asthma check at least once a year. So I do know that at some point in your asthma journey, you may feel that you are absolutely well controlled. You don't need treatment at all. But I think you should still see your doctor maybe once a year, just to have a routine check and just see that things are going well. And during those appointments with your doctor or other healthcare provider who's providing asthma care, you should ask for an action plan. What to do if your asthma gets worse. And you should write that down to have it written down on paper to be able to find it easily. For example, your doctor may suggest that if you're starting to have a lot more asthma attacks, or if your asthma is no longer well controlled, to increase your inhaled medication. Now that can be doubling the dose, or taking it maybe more often, or maybe taking some extra medication that you might store in your house. So these are things that can be written down so that you know what to do if asthma worsening occurs. The fourth thing I'd like to mention is that if you suffer from allergic asthma, so that is asthma triggered by different allergens, it's very important to know what you're allergic to. So this should be done as early as possible in your diagnosis. So for example, if you've been diagnosed with asthma, it is suggested that it's allergic. It's important to know whether you're allergic to house dust mites or pollens, various pollens specifically, or certain molds. It's important to know these things, and it can be identified by having allergy tests, which may be skin prick tests or blood tests, or maybe your own history, your own observations may suggest what you're allergic to. Because if you know, then you can avoid those things, and that can help reduce the inflammation in the airways, and that will help you control your asthma much better. The fifth thing I'd like to say is that you should try to take your medication even if you are feeling well. So if your asthma is relatively well controlled, it just means that the medication you're taking is really taking care of the inflammation and keeping you from having asthma attacks. Now, obviously, if you've been on the same inhalers, for example, for maybe 6 months' time and you're feeling absolutely perfect, you haven't had one asthma attack, you should discuss with your doctor about potentially reducing the dose, stepping down your treatment. That can be done as a trial. And if you're continuing to feel well, great, on the lower doses. But if, for example, you're on the lower doses and you're starting to get more attacks, you're starting to feel something is not right, you should talk to your doctor about going back to the minimal amount of treatment that was keeping your asthma well controlled. Number 6. Here I'd like to discuss about inhaler technique. This is really, really important to get down well. So obviously, if you're having an inhaler, you might notice that at the beginning it can be a little bit difficult to use. So I've got like a Ventolin reliever inhaler here. Now this one can be a little bit fiddly. You might be, how do I press this so that it works? So these things are really important. If you don't know how to use your inhaler well, you won't be able to inhale the medication to the right part of the lung, the deeper part of your lung. Now, each inhaler has a slightly different mode of use. So it's important to learn these at the beginning, to learn them well, show your doctor, demonstrate the technique so that they can help you improve it. Every time you go to see your doctor, I think you should take your inhaler with you and try to use it in front of them so they can direct you whether you're taking it in the right way or you may need to improve it a little bit. Because obviously, if you're not taking the inhalers correctly, you won't get any relief. Your treatment may seem like it's not working, but actually it may be the technique, the medication may be absolutely perfect, but it may not be reaching the right parts of the lung. Now, I have several videos on my channel about how to use various inhalers. I do encourage you to watch them, and I'll try to leave links for these in the description below, or you can click on my name below and see the videos that I've uploaded, and you'll find the inhaler technique videos. I hope these are really helpful for you, but it's really important to learn how to use an inhaler. Number 7. If you are struggling with inhaler technique, it may be helpful to use a spacer device or to have one of these around the house. Now, spacers come in various shapes and sizes, but basically they're these base canisters or whatever you want to call them, where you can connect your inhaler to one end and then spray a puff inside it and then breathe out and inhale slowly from this device. Now, that obviously helps you synchronize your breathing a little bit, because sometimes you may find it hard to press on the inhaler and inhale deeply at the same time. So that can help. Having one of these can be helpful, especially if you're having an asthma attack, when your breathing's really fast and you can't really synchronize. You seem like you're not getting any relief. You're just puffing the inhaler but can't really inhale it properly because you can't hold your breath. You're so breathless. So in those cases, having a spacer may help. Learn how to use it well. Again, I have links on how to use these below. But basically, I'll show you here in just a quick demonstration. So, for example, if I want to take this Ventolin inhaler, right? And I can't seem to synchronize my breathing well. So what I will do is just connect it to the spacer, breathe out, so I empty my lungs so I have space to breathe in. So I breathe out and then I'll puff a spray inside this and then slowly inhale. So I'll show you right now. So breathing out. and slowly release. Now, obviously, try to hold your breath for as long as possible, but this is one way to use one of these spacers. Now, there are different models which may be used slightly differently, but this principle is the same. You are having this chamber in which the vapors released from this inhaler are floating around, and you can just have a bit more time to inhale them. The eighth thing I'd like to discuss is basically about keeping a diary, some kind of an asthma diary, or some notebook in which you can write your observations about your condition. I think this is essential, and many people don't actually do that, although it's a very simple thing to do. Now, your doctor may provide you with some sort of a patient diary that is already pre-printed and you just fill in some bits. But if you don't have that, that's not a problem. You can just buy a notebook somewhere in a shop and just keep track of observations with dates of what happened. For example, if you were dusting around the house and you had an asthma attack straight after, or you went for a run and 5 minutes after you finished running, you had an asthma attack. These are important bits of information you may want to know, because this can help you manage better in the future. To try to identify triggers for your asthma. And as I said before, it's important to know if there's any allergen in the environment that's triggering things. Or for example, if you're going to work and there's something at work that's triggering your asthma, or on which days do you feel the worst? Is there some sort of a process at your workplace that's really triggering your asthma? Is there something around the house that's doing it? Is it stress? Is it emotion? Is it something else that's not easily apparent? It may become apparent once you start writing these notes down and reviewing them periodically. And also, the asthma diary or this notebook that you're keeping may be a good place where you can write your action plan. So what you've discussed with your doctor that you need to do in case your asthma is really getting worse. What dose of inhaler would you take? When would you take it? How often? When would you need to contact your healthcare team? Things like that are really important to have written down so that you don't have to think about, oh, what did my doctor say 7 months ago about this inhaler? How many puffs do I need to take? If you have it written down, it will be a lot easier for you to know what to do. Number 9 is to try to get one of these. It's a peak flow meter. It's a very simple device that allows you to measure airflow from your airways. So it's a very simple thing that you can use yourself at home. Now, normally you would do this standing up. I'm sitting on a sofa here, but basically with this thing, it's very easy. It's got a little indicator on the side. You just pull this down to 0, and then you take a deep breath in and blow fast through this mouthpiece. And that will allow you to measure how quickly you can get air out of the lungs. So I'm just going to do one now so you can see how this is done. Pretend that I'm standing up, because you should be standing up straight. So I blew through this, and basically it gave me a value of 450. I'm not sure if you can see it on the camera. But basically this could be good or bad. It depends on your own personal circumstances. But if you keep track of these numbers over time, you can get an indication of how your asthma is behaving, how your lung function is behaving. If it trends up, great. If it trends down, well, you might want to consider why that is happening. Now, every time you do this, I would suggest doing it 3 times each time. And average number, because my blow now wasn't so good, but probably if I do another, I'll get another number. So try to do 3, get the middle value or something like that, and maybe write it down in your notebook, because if you keep track of these over time, it can be an indication whether your asthma is getting worse. Another thing you can do if you've got one of these peak flow meters is when your asthma is actually getting a little bit worse, to try to do these measurements twice a day. In the morning and later in the day, in the evening, late afternoon. And if the difference between the values you're getting within the same day tends to get bigger, so for example, you're getting, 300 in the morning, and then you're getting 320 in the afternoon, but then this difference becomes bigger, it may suggest that your asthma is actually getting worse. And it may suggest that you might need to go to that action plan you've established with your doctor to change your medication slightly to prevent worsening of your asthma, or something else may be required. But it's a good way of keeping track and actually putting a number on your symptoms. Number 10 relates to acid reflux. So if you're having gastroesophageal reflux, it's really important to keep this under control. Now, this can be achieved through your diet, so knowing what foods cause acid reflux and heartburn, you should write these down as much as possible and try to craft a diet around these so that you are able to, eat well, but also not eat things that might make you unwell, because the acid that comes from the stomach can be inhaled in your lungs and it may actually worsen your asthma, worsen the inflammation that leads to worsening of asthma. So for most people, for example, having heavy meals right before going to sleep is not a good idea, because when you're lying flat, some of that acid may come up and you may be inhaling that. Obviously, very acidy meals, especially late in the day, may also cause this. So the first thing would be obviously to try to eat light meals in the evening and try to maybe walk around a little bit or not go to sleep immediately after your meal. Maybe leave a gap of a couple of hours and then go to bed. The other thing is when you're lying flat, if you feel, for example, the acid coming up, or you feel a metallic taste in your mouth, heartburn, things like that, or if you start to cough when you're lying flat, it might be a good idea to try to think about raising the head of your bed a little bit. So, for example, if you are lying flat in your bed, one thing you could do is add more pillows behind you, and that might raise you a little bit. But what normally happens is that as we sleep, we tend to slide down in bed and our head ends up like this, but basically our chest still remains flat, so the acid may come up. So what I would suggest in these circumstances, if you can roll a little blanket and put it under the actual mattress or something like that, of that nature, might actually help lift you up a little bit and keep the acid down with gravity. But of course, you don't have to lift your mattress all the way up. Maybe like a 10-degree angle can still help a little bit. And one other thing I'd like to mention, if you are slightly overweight, to consider about managing that weight. Because obviously having quite a little bit of weight on your stomach here will worsen the acid, because it will help push some of that acid up. So trying to maintain a healthy weight is really helpful in controlling acid reflux as well. And your doctor as well can prescribe some treatments, so go see your doctor about treatments for acid reflux if you can't manage it otherwise, because there are quite effective ones out there. Number 11 relates to smoking. So if you are an active smoker and you have asthma, it's a very bad idea. It's a very bad combination, because inhaling smoke in your lungs will worsen the inflammation, will worsen the irritation in the airways, and that might lead to more asthma attacks, more inflammation, and it will make the effect of your inhalers less. So basically, it's a bad combination to smoke while you're having asthma. So I know it's really hard to quit. I know. But it's really important to try. And if you can't do it on your own, do see your doctor about advice. There are smoking cessation services throughout the world. There is advice out there on how to quit smoking in a good way that will last you for a long time. So I think it's really, really important to try to quit. And then using vapes is not necessarily a much better idea, because you're still inhaling things in your lungs that may be triggering your asthma. So I would say if you are going to switch from a normal cigarette to a vape and then maybe quit, do it that way. But don't stay on the vape forever thinking that it's a much healthier choice, because I don't think it really is. All right, number 12. Here I'd like to talk about your environment. So have a think about how you are living. If you are living in a house that is really dusty, moldy, there's damp around your house, try your best to fix that. Try to ventilate the space where you spend most of the time during the day, because you would want to breathe in clean air. So if you've got old books and magazines stashed together in your home and they're really, really moldy, you might want to do something about that. Maybe move them somewhere else. Or if your house is really dusty, try vacuuming and wiping the dust with a damp cloth as often as possible. Open the window quite often. Things like that may actually help get rid of some of those allergens that might be worsening your asthma. The same is true about your workplace. So if you're, for example, working in an environment that's really not good for your lungs, not healthy, talk to your employer about improving the conditions there as much as possible. Now, I know that may be hard, but you need to prioritize your health. You need to talk to your boss, to your employer, about how you may ventilate the space better. Or if you're involved in a certain process, for example, at work that makes your lungs really worsen, you might have to ask about being moved to a certain job that doesn't involve doing that specific process, or something that works in your case. But I think it's really important to try to breathe in clean air as much as possible. This is true for both your work and your home. And the final point I'd like to make relates to physical activity and exercise. I think you should maintain that to the best of your ability. So there is no contraindication to physical activity. Even going for a walk is not contraindicated. Most people can do it, but unfortunately our lives are structured in such a way sometimes that we can't do it. But I would really suggest that that should be a top priority if you're having asthma, because it will improve a lot of things. Not necessarily the asthma directly, but it will regulate your metabolisms. You will lose a little bit of weight if that's a problem for you. Your respiratory muscles will strengthen. You will be able to cope better with breathing difficulties when these happen. And you will get overall health benefits by just walking around, being outside in clean air. We weren't built as humans to be sitting on sofas and office chairs all day. We need to be out and about, and that will keep us happy and our asthma under control. So I hope you found these tips helpful in your case. If you liked this video, do like and subscribe because it does help the channel quite a lot. But if not, I'll see you in future videos. And all the best to you and good health. I hope you'll manage to control your asthma as well as possible. All the best.